In this video, we will be focusing on the bony pelvis. Let's start off with the articulated pelvis, which is made up of a pair of innominate bones, the sacrum and the coccyx. It is held together by two synovial sacroiliac joints and the secondary cartilaginous sacrococcygeal joint posteriorly, and by the pubic symphysis, which is also a secondary cartilaginous joint anteriorly. In the anatomical position, the pelvis is not found horizontally, but is found tilted anteriorly, with the anterior superior iliac spines and the pubic tubercles on the same coronal plane, and the tip of the coccyx and the upper border of the pubic symphysis on the same horizontal plane. Joining the anterior superior iliac spine and the pubic tubercle would be the inguinal ligament. Now let's take a look at the innominate bones in the articulated pelvis. The innominate bone is made up of three separate bones: the ilium, ischium, and the pubis. At birth, all three are connected in the area of the acetabulum, but later in life they fuse to form a single bone. The ilium is the largest of the three and expands superiorly like a wing from the acetabulum and forms the ala, with a characteristic ridge called the iliac crest extending from the anterior superior iliac spine to the posterior superior iliac spine on the superior margin. On the posterior aspect of the ilium, there is an indentation called the greater sciatic notch above the ischial spine. The convex gluteal surface has three gluteal lines: posterior, anterior, and inferior, which provide attachment for the gluteal muscles in between. The concave pelvic surface is called the iliac fossa and gives origin to the iliacus muscle in the anterior aspect and the articular surface for the sacroiliac joint. The iliac fossa form the lateral walls of the false pelvis, the region above the pelvic inlet, which will be explained later. The clinical importance here lies in that the pubic tubercle can be used to differentiate between femoral and inguinal hernias. As seen in the diagram, femoral hernias are below and lateral to the pubic tubercle, and inguinal hernias protrude above and medial to the tubercle. The sacrospinous ligament and the sacrotuberous ligament, which are inserted from the sacrum onto the ischial spine and ischial tuberosity respectively, create two gateways, which are the greater and lesser sciatic foramina. The piriformis muscle further divides the greater sciatic foramen into an upper and lower part, which provide passage for the gluteal vessels, gluteal nerves, sciatic nerve, and many other nerves out of the pelvic cavity towards the gluteal region. The lesser sciatic foramen transmits the internal pudendal vessels and pudendal nerve, which emerge out of the pelvic cavity through the sciatic foramen and pass back into the perineum. The ischium and pubis form a foramen in the inferior part of the hip bone, which is called the obturator foramen. A major part of it is covered by the obturator membrane, except for a small area which forms the obturator canal, which is a gateway to the lower limb, providing passage for obturator nerve and vessel. The bony pelvis can be divided into two main parts: the true pelvis and the false pelvis. The line of demarcation between the two parts is the linea terminalis. It is formed by joining the sacral promontory, sacral ala, arcuate lines, pectineal lines, and the pubic crests. The linea terminalis defines the pelvic brim or the pelvic inlet. The region above it is the false pelvis, and the region below it is the true pelvis. Now let's focus on the main muscle attachments. The hip bone provides attachment for abdominal muscles, lower limb muscles, and muscles of the pelvic diaphragm and wall. On the pelvic surface, obturator internus originates from the obturator membrane and the surrounding bony parts of the hip bone. Pubococcygeus, a part of levator ani, originates from the pubis, while coccygeus originates from the ischial spine under the cover of the sacrospinous ligament. Iliacus originates from the internal surface of ala of the ilium. Along the iliac crest, the outer lip gives attachment to the fascia lata of the thigh and origin to the tensor fascia lata muscle. The anterior two-thirds of the outer lip of the iliac crest receives the insertion of the external oblique. The anterior two-thirds of the inner lip gives origin to the transversus abdominis muscle, and the intermediate zone between the two lips gives origin to the internal oblique muscle. Finally, we will focus on the major differences between male and female pelvis. There are many specifications in the female pelvis compared to the male pelvis for the functional purpose to accommodate childbirth. The general structure of the male pelvis is heavy and thick with large joint surfaces compared to the female pelvis, which is light and thin with smaller joint surfaces. Muscle attachments are well demarcated on the male pelvis, but they are rather indistinct on the female pelvis.